We're going to be talking about medical terminology today. We're going to look at some common terms that you'll hear in medical terminology, some common abbreviations, approved abbreviations that are important for you to learn, and how we can kind of talk about the body in more correct terminology when we are communicating with the healthcare team. Now, when we're communicating with our resident, remember, we always want to use the most correct terminology that we can that they will understand. So when we're looking at medical terminology, we'll start with a couple just basic rules here. The prefix of a word is the word element at the beginning of the word. So an example, DYS in front of a word means difficulty. The root of the word is a word that contains the meaning. So phasia means swallowing. So if we put difficulty, the DYS in front of the phasia, it becomes difficulty swallowing. The suffix is the word element at the end of the word. So cyanosis. Cyan is blue, osis is a condition. So cyanosis would be a blue condition, a condition where we see blueness in their tissues. A in front of a word is absent or lack of. Penia, for instance, is the root word for breathing. So apnea would be the term for absent or lack of breathing. There are also directional terms. So your lateral side is the outer side of the body. The medial side is the inner part of the body, more to the midline. So the inside of your legs would be the medial side of your legs. The outside of your legs would be the lateral side. There's also the term distal to proximal. So if I look at the arm, the shoulder is proximal. It's closer to the core of the body. Distal, your hand would be further out. There's also terms superior versus inferior, and superior meaning the upper part of the body, inferior, the lower part of the body. There are really common abbreviations that we'll be learning in this class, and you do need to learn them. So for instance, and these are just a few of them that we will be covering in the class, but AC, that stands for before meals. ADL, we've talked about this term, activities of daily living, those things that we do on a daily basis when we get up in the morning, when we get dressed, when we eat, when we take a shower. Ad lib is as desired. So a term, they can be up ad lib. That means they can get up as they feel they want to. AMB is ambulate, and ambulate is a fancy word for walking. BM is bowel movement, okay, going poo. C with a line over it is the medical terminology for with. So I know you guys will frequently put a W with a slash. That is not the common abbreviation for with. In healthcare, it is C with a line over it. C/O, it could be capital or lowercase, will be complains of. So complaining of pain, C/O, complains of pain. CPR stands for cardiopulmonary resuscitation. So when we're learning how to do our compressions and our breaths. DX is diagnosis. ECG is an electrocardiogram where they check and see the pattern of the heart. And ED is the emergency department. GI is gastrointestinal. So that's the digestive tract from eating all the way down as our food is processed to where it comes, the leftover food that's not processed comes out in the bowel movement. So from mouth to anus would be your GI tract or the digestive tract. HR is hour. HT is height. HX is history. ICU is intensive care unit. I&O is intake and output, recording the fluids that they take in, fluids meaning oral fluids, IV fluids, feeding tubes fluids, and output, urine, okay, drainage out of tubes. IV is intravenous. Lab, LAB, is laboratory. LB is pound. LOC, level of consciousness. So your level of consciousness, I'm awake, I'm alert, I know what I'm doing, I know what I'm supposed to be talking about. That way I have good level of consciousness. So if their level of consciousness has decreased, they might be lethargic, not able to respond to you. Meds, medication. ml, milliliter. And we record fluids in milliliters. Now, I will tell you that sometimes in a nursing home, you'll still hear them refer to it as cc's. In the hospitals, we almost always refer to fluids in milliliters, but in nursing homes, sometimes you'll hear it referred to as a cc instead of a milliliter. A cc and a milliliter are the same equivalent, but we do not record or document in ounces. NOC is night. NPO actually means non per Oz, but that means nothing by mouth. O2 is oxygen. OOB is out of bed. OT is occupational therapy. Ounces, OZ. And we're going to learn that 1 ounce is equivalent to 30 milliliters. So if you have someone who's had a 6-ounce drink of juice, we know they're going to have had 180 milliliters of juice. PC is after meals. PO means by mouth or orally. So they took in oral fluids, they took it in PO. The term PRN is as needed. So medications may be given PRN, like pain medications, the patient can take it PRN, meaning as they need it. PT, so large P, little t, or small p, little t is patient, where when you have a big P and a big T, it tends to mean physical therapy. A Q stands for every, so QH would be every hour, or Q2H would be every 2 hours. An R stands for rectal temp, or it can stand for respirations. R/O is rule out. ROM is range of motion. RT is right. S with a line over it is without. The term stat is at once or immediately, like you will do it right now. TPR is temperature, pulse, and respirations. And we're going to learn when we're documenting our vital signs, we usually do things in TPR order: temperature, blood pressure, temperature, pulse, respirations, and then blood pressure. UA is urinalysis. UTI is urinary tract infection. VS is vital signs. W/C is wheelchair. Weight is WT. ID is for identification, and we learned that we're always wanting to check our identification with our residents. We want to check their ID bracelet, and if they aren't wearing one, we ask them first and last name, and we can ask them date of birth to confirm it. PPE is our personal protective equipment, where we're learning how to put on our gown and our gloves and our mask. HAI is healthcare acquired infection. CDC is Centers for Disease Control. DNR is do not resuscitate. BP is blood pressure. SOB is shortness of breath. NKA is no known allergies. NG is nasogastric. FBOA is foreign body obstructed airway, so they're choking on something. And BR is bed rest, where BRP is bathroom privileges. And we are going to be learning about all of those. We're going to be talking about them as we go through the class, but they're really common abbreviations to hear, and you will be needing to get used to them. Now, common healthcare terms, we talked about some of those in that first chapter of communication that we looked at. We looked at these terms, but these are extremely common terms to hear in healthcare, and we will be elaborating on them and explaining them in more detail as we move through the class. But again, I want you to just get used to hearing them. ADL, activities of daily living. That is the primary function of what a nurse CNA does, is to help a person with activities of daily living when they cannot do it themselves. Assistive devices, we said, was helping them use other tools to help them be able to take care of themselves better. So if they use a walker, can they walk without us now? If they use something to button they make little devices to actually help button up your shirts. Maybe they could get dressed themselves now. So we want to try to make them as independent as we possibly can. And if assistive devices will help with that, then we will teach them how to use them. Atrophy, that's that wasting away of the muscles. And if you don't use muscles, if you have someone who has a weak side or they're not using their muscles are going to start wasting away. Care plan. doing a plan of care. So being able, again, that nurse is going to do the assessment. They're going to come up with nursing diagnoses. They're going to develop a plan of care of how they can fix whatever the problem is. So they come up with a nursing diagnosis of the nursing problem. They develop a goal of what they want to accomplish. And then what is that plan going to be to accomplish that goal? And as a CNA, we very frequently get involved in helping with that plan of care. We said cognitive function was our ability to think, rationalize, memory, judgment, critical thinking skills. And dementia, we said, was when we have lack of cognitive function to the point where it interferes with our daily living. Contractures are abnormal shortening of a muscle. Dysphagia, we said, was difficulty swallowing. Dyspnea was difficulty breathing. Feces or stool is having a bowel movement. Fever is running a temperature. Fowler's position is usually the head of the bed up 60 degrees, and there's semi-Fowler's where the head's up usually only 30 degrees, then 30 to 45. 60 degrees is generally Fowler's position, and then 75 to 90% is usually high Fowler's, so sitting them all the way up so they can eat. Incontinence is not having control of either urine or bowel or both. The perineal area is the privates. So when we wash a female, or we're washing down where the urethra, the vaginal area, and the rectal areas, that's their perineal area, the perineum. Pressure ulcers or pressure sores that happen from either laying on tubes or laying in one spot too long. The prone position is laying on the stomach. Semi-Fowler's we talked about. Signal light is your call light. Supine is lying on the back. Vital signs is doing temperature, pulse, respirations, blood pressure, and pain level. And voiding is going pee. So we talked about this in our communication chapter. We're just reviewing it again, and we're going to be hearing those terms. We're going to be reviewing these terms a lot as we go through the class. There are other terms that we'll hear as well, but these are the ones we're going to tend to focus with. Now, the other thing I just wanted to mention is the other thing you might see here is quadrants. So quadrants are when you split the stomach, like let's say you split the stomach in 4 sections. So if I took this picture right here and I drew a line down the middle of the stomach, and then I split it across the umbilicus area this way, this would be the left upper quadrant, this would be the right upper quadrant, this would be the right lower quadrant, this would be the left lower quadrant. So there's a lot of terms that we'll be hearing when we start talking about range of motion. We're also going to be learning directionality terms as far as flexion and extension. So if I'm moving my arm up towards each other, like I'm bunching the muscles up, pulling something up towards me, I'm usually flexing my muscles. If I am extending them, I'm putting it back out flat. You're going to hear the term abduction and adduction. So if I was taking my leg and I was moving it out this way, away from midline, so here's midline, and I move the leg out, that would be abduction. Moving away from the midline is abduction. And then if I had my leg out here and I was moving it back to midline, that would be adduction. So we're going to be hearing about a lot of different directional terms, a lot of terminology as we go through this class. Even though this isn't a medical terminology class, we will be learning these things as we're going through it. But you are going to be hearing these things over and over and over, so it'll help sink in for you.